to COVID. So we'll get started right away. On the panel tonight, you have Jack Manning, who is the Glassboro OEM coordinator. You have Chief John Polillo of the Glassboro Police. You have Joanne Connor, President's Chief of Staff. You have Tony Lohman, Provost. You have Scott Woodside, Director of the Wellness Center. Kevin Coet, Dean of Students. Mike Cantner, AVP for Public Safety. And Monica Shealy, SVP for Diversity, Equity, and Inclusion. We have an hour. We will try to get to as many questions as we possibly can. If we can't, you can email any one of the panelists and they will be certain to get back to you. So unfortunately tonight, Mayor Wallace could not join. Work obligations prohibited him from joining, but he did write an opening statement, and I'll read that opening statement right now. Good evening, everyone, and welcome to the second Glassboro Rowan virtual seminar to discuss community issues as they relate to the ongoing COVID-19 pandemic and the reopening of Rowan University. I apologize to you all for not being in attendance. Though I truly understand the importance of this panel discussion, my work obligations preclude me from being present. It is no secret that a number of positive cases has risen over the past several weeks in Glassboro. As concerning as it is, the rise was anticipated and a plan put into place. Borough officials and Rowan officials have been communicating on a regular basis, are actively working together to ensure that the spread of this virus does not continue to rise and that all necessary information is available to you, which is why we are here this evening. I would like to thank Joanne Connor and all the other fine members of this panel from the Borough of Glassboro and Rowan University alike for taking the time to address the questions and concerns of the community at large. Have a wonderful evening. Be safe and be well. John E. Wallace III, Mayor, Borough of Glassboro. And at this time, I'd like to turn it over to Jack Manning, OEM coordinator for Glassboro, to give an update on what we're seeing from the Glassboro side. Jack?
I apologize for my video keeps cutting in and out. I know I was up there a minute ago, but now I'm not. So I just want to say good evening and thanks to everyone for participating in tonight's panel. I'm going to mirror some of the things that the mayor said. And I know that I've already been introduced, but my name is Jack Manning. I'm the Director of Emergency Management for the Borough of Glassboro. So since March, we've been diligently working with the state, the county, our neighboring emergency management partners, including Rowan University's emergency management, to keep everyone who lives, works, plays in the borough safe and healthy. That's been our primary goal the whole time. We implemented a team approach to many major and non-emergent decisions regarding COVID-19 within the borough. The communications and cooperation between government and non-government entities have risen to a level that in my 36 years in emergency services, I've not experienced. With that said, I fully understand everyone's concerns, and everyone in the community has these concerns regarding the positive test numbers, especially among the 18 to 22 age level. Since March, we've remained around the middle of the statistical pack relative to the other municipalities in the county. We ran around, out of the 24 municipalities, we kind of hovered between 10 and 12. But since the start of this month, we've rapidly climbed toward the top in per capita COVID positive test results. While we did not, this wasn't unexpected, it's still unnerving for most of us, especially those of us who are working with it every day. Now, some of the steps we've taken as a municipality since the beginning of the pandemic include the closing of our parks and municipal facilities, canceling borough-sponsored or supported gatherings even before restrictions were implemented and we were forced to do it. But we modified our employee schedules to minimize the chance for cross-exposure among borough staff, provided guidance and interpretation of executive orders, directives, and other information coming from the state to our municipal departments, our community, businesses, and schools. In recent months, we've been involved in planning a safe and responsible reconstitution of government and a kickstart to our local economy with some of the things we've been sponsoring around town. We've met with Glassboro School District and University numerous times to discuss plans and concerns as we approach the start of the academic year. I knew that was going to be a big hot topic as that time approached, so everybody was ahead of the game when it came time to plan these things. We believe that both the university and the school district, as well as the borough, have developed comprehensive plans that keep the safety of students and the community members as the #1 priority in those plans. We all understand the frustrations you have, and on their face, the solutions may be simple. I'm sure you can think of a lot of solutions that we could have done to stop this, but they're not on their face. They're not very simple. When it comes to extreme measures, the municipal government doesn't have the authority to modify executive orders. So if the executive order says people can do it, and we can't change that. Nor can we legally restrict where people live, provided their living spaces obviously meet the requirements of housing and construction codes. We can't order schools and businesses to comply with executive orders to close. We can't require people to quarantine or restrict the legal movement of people as well. Some of the things we can do is we can make sure that the messages from the CDC and the health department are relayed to our residents. We can encourage the permanent and temporary residents of the borough, especially those who are in that 18 to 22-year-old age range, to act responsibly and take measures to reduce exposure risk, stop the spread, and protect the vulnerable population. So it's not just the responsibility of government, it's not just the responsibility of the university, but it's the duty of all members of the Glassboro family to take care of one another. That's pretty much all I have. And again, I thank you for participating in this forum. I hope we could adequately answer any questions you may have. And if you do have any suggestions, we'll listen to them. And if we could do things, we'll do them. But obviously we have to respect rights in the Constitution and all those other documents to protect us. So thank you.
Thank you, Jack. And at this point, we'll turn it over to Tony Lohman, who will provide an update on Rowan's academic plan for the fall.
I want to thank all. I forgot to unmute. It's after all the WebEx and Zoom, you think you'd remember to unmute first. But thank you for the invitation to speak. I welcome the opportunity. I see a large number of attendees from our community, and I'm glad you're here, and I'm glad we can address your concerns. Rowan is part of Glassboro. Glassboro is our home, and we want to be a good neighbor, and we want to be a good resident as well. So speaking about our plan, we've been working very hard. For many of us since March came, we had to turn and look about what would a fall look like, and a lot of planning went about. A lot of people spent a lot of time coming up with a plan, working with the state and figuring out a way, how can we get our students back in a responsible fashion, and how can we provide this group of 18 to 22-year-olds what they need at this time. They need an education, they need a chance to grow up and continue their college experience. So we worked very hard and came up with a very flexible plan that was going to be guided by public health. Public health data that comes from sources, comes from hospitals, comes from the state, comes from the county, comes from the municipalities. And we take all this guidance in and on a day-by-day basis, we're looking at what's going on to guide our plan. So when we started our opening a little over 2 weeks ago, we started with just under 20% of our classes being offered in some type of face-to-face format, and about 80% of our classes being totally remote, with an idea that at some point in the semester, if public health told us it was okay, we would ramp that up to as much as 40% of our classes would have a face-to-face component. When we look at our data, it's fallen in line with, I think you've heard folks from Glassboro say, it's fallen into where we've expected it. But we want to make sure that we continue on a safe path. So we have maintained our status quo of operations with about 20% of our classes in a face-to-face component to minimize the people actually coming onto the campus, to minimize the interactions, and to allow really public health to make sure we're doing all the right things. So we'll continue to watch and we'll continue to adjust our plan accordingly. I've seen a lot of comments, a lot of questions came to this forum before, and we're hearing it on our own campuses. Look at what's happening on campus XYZ, look what's happening on this campus, and look what's happening on that campus. Cases are occurring all over the country on college campuses, and colleges are dealing with it, and colleges have their plans in place. And no two plans are the same, nor are any environments the same. So what we see is happening at school X doesn't necessarily mean the same thing is happening here, and vice versa. A number of the colleges that people saw in the news as being hotbeds of coronavirus cases and not seeing what they're doing, activated plans, paused what some of the things they were doing and took a short break to allow the cases to settle. And in fact, you're seeing success stories at campuses all throughout the U.S. Notre Dame, and you saw, was one of the big hot points all over the news 2 weeks ago. They took a pause. Classes came back in the last couple of weeks, and if you watch your TV on Saturday afternoon, you see Notre Dame football in all its glory with students in the stands. So this can be done when we're cautious and do things right and work through our plan. And we're confident in our plan. And again, I said we're flexible with this plan, meaning if cases spike, if we get to a situation where we're not comfortable in our testing and contact tracing ability, then we will modify our plan. And if we have to, we'll begin different types of mitigation efforts where we scale back our plans, which could include more online classes. It could include restriction of campus activities. And the most extreme case, if we were forced by public health situation to have students leave the dorms, we'd of course do that. But with that, I want to point out a very important fact, which has come out from the CDC as well as some of the task force on the coronavirus, is the safest place for the students and the safest place for the communities is students in their residence halls. So for some of our students, this is their only housing. This is where they have access to technology to continue their education. This is where they have access to healthcare. So this controlled environment provides a safe experience for many of our students. And it provides safety for the community. When they're in these dorms, we can create the environment, we can create activities, and we can make sure that they're doing the things they need to do. The last thing we would want to have happen is dorms closed down and students moving out into the communities where we have the rental properties that already have a large number of students in place. We don't want to put more in those by closing down our dorms. So we're very cognizant of the concerns, but we are on top of this. We have a team that meets regularly, daily, sometimes more, weekends, where we're constantly staying on top of this, and we're constantly doing everything we can to provide a safe environment for our Rowan community as well as our Glassboro community. So with that, I'll turn it over to the next phase for our folks who can talk specifically about the things we're doing with our students and the testing.
Thank you, Tony. Appreciate the comments. And at this point, it's Scott Woodside to talk about health and safety. Scott?
Thank you so much. I really appreciate everything that you're doing in Glassboro, and Jack, your comments were spot on. It was I can't thank you guys enough for your leadership as well. Dr. Loman and Joanne, thank you so much for what you just said. I mean, we've been working very closely, as you can imagine, over the past 6 months, and I'm grateful really for the opportunity to be here for this town hall, and really to be on with a panel of so many dedicated people. It really is heartwarming, to be honest with you. But I want to stress really at the beginning of my brief comments that I know many of you have questions, and really my personal goal here is to be as transparent and helpful as possible. Being someone who's in the middle of this, and Dr. Kett will certainly speak to all of our activities with our students, as he's the dean of students, and I've been working very closely together to help manage students on and off campus and navigate where we are right now. So really, as everyone has said, as spring turned to summer, we know that for Rowan and Glassboro to manage really the close to 10,000 students that are essentially on and around our campus at this time, that we needed to be honest in terms of our reporting. And I think you'll find that there are many schools that aren't reporting any numbers at all. So that was important for us to make sure that we're reporting numbers in all earnest, so that everyone can see what's going on. We need to be prepared to test and isolate, and really to be dedicated to our partners across the region. Yes, of course, Glassboro, but so many more. We have multiple campuses in South Jersey, and so many connections to our local health partners. So we need to be good partners to them as well. So in order to accomplish this, we have been planning and for months and months and executing our return to Rowan plan. And it, as Dr. Loman had said, it's designed to be flexible. That is at the heart of it. But if at the heart of it, is flexibility. Wrapped around it is really responsiveness and protecting the most vulnerable, which we know based on science and COVID that we can identify who those individuals are. So we know that, and everything we did in terms of planning is thinking about that. Our strategic partnerships with Gloucester County and especially the health department, local healthcare systems are absolutely critical to our plan. I could tell you I have an amazing relationship with them. I'm the former director of public health nursing at the health department, and I have been in constant contact really for months, but really especially over this past month daily. We're connecting, we're sharing information back and forth, helping to clarify data that's coming in because there's a lot of data to go through. So that coordination information has been critical. The delivery of healthcare on campus and off campus has been critical. Our EMS, which always supports the county EMS system, has continued to do that, and our EMS has been amazing on campus for us in helping students on campus getting to our isolation areas and supporting them if necessary, and especially access to testing. So those are the big components of our plan. I would say the relationship with the county is, I just want to highlight that because for those of you that know, when the county ran the testing clinic back in April and May, it was Rowan and our team that stepped up to help them with that, and we're doing it again starting next week. So there'll be an announcement coming out later this week regarding testing that's going to be opening up again for the county and county members, which includes, of course, all of you in Glassboro. So that's important to know that Rowan is leveraging what we have in our expertise with Rowan Medicine, our School of Nursing, the Wellness Center, and of course the public health and emergency preparedness experts at the county. We've worked very closely together, and we're going to continue to do it to be good partners. But I really want to be frank with you all. Our public health folks are working really hard. As you can imagine, during a pandemic, they are going a million miles an hour, and as are we, and as is all emergency management folks, as Jack had mentioned. So we are all working really hard, and we have to work together, as Jack had said. I agree with his sentiment that the relationships that we have between Glassboro and Rowan have been as strong as they've been. He said 30. I've only been here 8 years, so I know how amazing they are right now. And I can tell you, in the talks that I have with the county every day, at this point, there has been no known epi link related to. I'm sorry, that might be public health talk. So there's been no known connection identified in their investigation, between any Rowan-related cases in the county. So that's important to know. And now I'm not saying that we can prevent every such occasion, but we're doing our best to identify and rapidly isolate individuals to protect, everyone in the community, especially in Glassboro. Now, before I discuss some of the statistics that we have on campus, I really want to talk real quick about the efforts, and I know I'm probably going on too far now, but many of us on this call right now at Rowan meet regularly every day, formally 3 times, but it's every day, to review the metrics, looking at our ER capacities, what's going on there, our ICU capacities, COVID tests that happen in the hospitals. We look at our confirmed case counts in South Jersey. We review the testing data that we're doing on and off campus, our asymptomatic surveillance. We review the isolation and quarantine status. We currently maintain a facility on campus where we isolate students, and Kevin will talk probably a little more about that. We currently have 43 students in there right now that we're keeping healthy and safe and isolated from the rest of the campus and the community. Last week, we opened a pandemic operations center. And so Kevin and I have been operating there with our local emergency management, Steve, who's been coordinating with Jack to ramp up our efforts. We've doubled down on efforts on our off-campus surveillance as well. We've created a team of people that reach out to any known students that are off campus and isolating or quarantine every day. So we're making sure we're in contact with them every day, and we're doubling down our efforts there really on a regular basis to make sure that we are staying on top of those students, giving them good information and good education, making sure that they're able to be taken care of. Students, of course, could take advantage of our triad resources in terms of isolation, and they're offered every time we reach out to them. They are offered as well. So really, let's get to some of the statistics. I could tell you that statistics in general can be difficult, and having managed and dealt with the world of statistics and public health for a while, there are pitfalls. And I think anyone that looks at statistics as something other than a trend can probably find themselves frustrated. So it's important to say that our state health department, our partners there have been fantastic. I've personally been on 2 conference calls with them over the past month just to make sure that they're on the same page with us. They understand our protocols and our procedures. They wanted to know, make sure that we're following all public health. They've approved all of our plans, and we're working really closely with them. Really amazing partners, and they've done really an amazing job. But to be honest, the amount of data that's coming into them, and then you layer on top of that higher education, where students are coming from different counties, different towns. So when they get tested, it sometimes gets reported to that county. The investigators follow up. They transfer that to our county to follow up. So a lot of times we at Rowan are notified probably before it goes through that process, because a student is being asked to self-report to us. So we take action sometimes ahead of time. And I'm saying this to you so when you look at numbers that coming from one source, look at numbers coming from our website, they're not going to match up. And that's intentional, because we are trying to be as deliberate as we can as putting out those cases as we know it out there. And that's not to say that anything is being hidden in any way, shape, or form. It's just how the data is coming in and how we're collating it. And the state's done an amazing job processing all that information using the state contact tracers that they've invested in. And we are partnering with them as well. So that's a little bit complicated, but I'm just explaining to you what that data does look like, and how difficult it can be sometimes to track that data. So let's get into some of our statistics. I think it's important for you all to have that information. As of right now, Rowan is aware of a total of 240 cases, really since early August, that have been confirmed and followed up with and investigated. We have another 60 cases that have been pending that we are investigating right now. We have 154 active cases that we are tracking. So the difference between the first number I reported and this number is the first number is historical, right? So we're looking going back to the beginning of August compared to what I'm actively tracking now. We have identified 60 houses off campus that we are currently following up with that have at least one case in it, or had one case in it. So it's important to know that we are on top of those. We are reaching out to them every day. We're offering them isolation capacity in triad if they choose that. So that's going to continue. We've performed asymptomatic surveillance testing of students. This is really our 3rd week in doing that. That's at a positivity rate of 4%. So we've identified those students. We've isolated them rapidly. And they're actually isolated in their parents' home, the individuals that we did identify through that process. So it's important to know that we are looking at these numbers. We are doing testing every day on campus. We are looking to expand that testing. Actually, in fact, we are increasing that testing this week, and we're also doubling the asymptomatic testing program that we have starting next week. So there's going to be lots of opportunities for us to test students, identify them, and take action with really what's necessary. That's the public health intervention, is isolation and quarantine. And that's all I had to say. I probably went on too long, and I'm happy to answer questions during this process or afterwards. So thank you for the opportunity.
Thank you, Scott. Much appreciated. Our last speaker before we go to questions will be Kevin tonight, and Kevin will be talking about what's happening in the residence hall and how student life is working with the students. Kevin?
Good evening, and I certainly appreciate everyone being here, and I want to thank Dr. Connor and Ed and the Glassboro administrators for their really strong collaborations and supporting this effort tonight. So we certainly know that COVID is causing lots of thoughts, concerns, and anxiety with folks, and I appreciate those who are in attendance tonight taking the time to share their thoughts. That's really important to us. As they've talked about, I have many of the areas of responsibility that may be of concern to many of you, and the first being housing, and I know Dr. Lohman talked a little bit about this, but we have about 4,100 students that are living on campus with us. And that's an important piece that we learned certainly in the spring that a number of our students needed housing, needed technology. And so if you take this down to Maslow and talk about housing and food and shelter, those are things that many of our students need. And without that, they couldn't get their education. And so that's important that students are able to get the resources that we're able to provide them in an on-campus environment. We certainly know that life has changed in higher education and at Rowan, and that started early on. And so many of you know that the governor had states that were listed as quarantine states. And we started over the summer, and we had about 500 students that we, Scott and I and others, worked on identifying from out of state. We were in constant communication with them to do their quarantines to see were they ever coming to campus, were they going to be completely remote. So that started then, and then we went to our move-in process where we extended that over a 10-day period to promote social distancing, and so that everybody wouldn't hit the Glassboro community at the same time. And that seemed to be very effective. Students came for appointments and seemed to be effective with de-densifying and social distancing. Our residence halls are de-densified, as we talked about. Normally at this time we would have somewhere about 6,800 students living on campus, and right now we have about 4,100 students. We have a number of activities that are still going on, but many of those are virtual. And so that which we do in person is social distance. Many of our events that are in person, people have to register for, and where normally they might just show up, now they have to register, they have to sign up. But a vast majority of what we do is online and virtual, and that's one, to promote social distancing, but also to understand that we have thousands of students that are online and remote, and we want them to participate in our activities just as the students who are living in the residence halls are doing. We certainly have limited the number of guests in our residence halls. We've done a number of other things to try to help with that. Scott talked a lot about our isolation housing. I won't belabor that too much, but I want folks to know that does apply to on and off students who live on and off campus, and we're taking care of their meal situations. We're providing activities. We're providing them support, and so Triad is not just a situation where we're putting students on the other side of campus and saying good luck, we'll see you in 14 days. That's not happening. We're really paying attention, and students certainly know, and that's one thing that's always a question. I can't force a student to come from off campus to isolate or quarantine on campus, but we certainly have that opportunity if that's something that they need, and that's important. I think mostly people want to know about accountability, and I think that's something that's important. We have added a very specific code section to our Code of Student Conduct this year that talks about compliance with health standards and health guidelines. We've educated our students. There are a number of things that they had to do before coming to campus. I also want to compliment our landlords. We've had a number of landlords who have worked collaboratively with us, and certainly Joe Cardona and others have helped coordinate that. But so as citizens, that we've had landlords that are just as invested and are working with us. And we gave out bags with masks and thermometers and educational materials to students on campus and commuters, but some of our landlords really helped with distributing that. So I want to really appreciate the landlords who have stepped up and helped us in this cause as well. We want people to know, we want to hear their concerns. You can go on the Dean of Students page, and we've publicized this in letters to the community and with our landlords, and there's an online form that you can report a concern. I can tell you that we look at those. I read those myself. They come directly to me. I hope that the Glassboro administration and police department would say that we are being very collaborative with them. If they call me at 3 o'clock in the morning to come out with a situation, I promise you I will come out with a situation and talk to our students. So we're being very collaborative in addressing the concerns that we have. But I think it's also important to note that we're going to give our students due process. We're gonna make sure that when allegations are made, that we're going to investigate it. We're going to look into it. Students have been held accountable. We have changed student statuses. We have suspended student organizations. So we are taking the concerns very seriously, and we are holding them accountable to the best of our abilities, and certainly based upon the individual circumstances. But just because an organization might be suspended, or just because a student status might change related to the institution, it doesn't mean that they're going to leave their houses in the community. And I think that's an important piece. And we have responded to situations, and again, thank you to Glassboro Police and the administration, but we have responded to situations that haven't been student houses, and we have found that out. And so we're going to respond to all the concerns that come to our attention, and when it's our students, we're certainly going to address them to the fullest extent possible. And then lastly, I just want to again thank, there's so many people from Rowan Police to Rowan Facilities to faculty and staff, and Scott and his team have been doing just incredible work. But so many people connected with the university. Glassboro has been amazing partners. I promise you, we're working very hard to address your concerns, listen to your concerns, and help our students understand the importance of being good citizens and helping us get COVID under control. So I will be quiet and happily entertain any questions. But thank you again for being here tonight.
Thank you, Kevin. Much appreciated as well. And everyone who spoke, thank you all. We'll get to questions. We do have a number of questions, but if anyone on the line wants to ask a question, I am monitoring them. I will do my best to get all of them. And the first one is, and this is the question we received the most, is there a set number of COVID cases for Rowan to close? I'm not sure if it's in Rowan.
I'm going to start with that, and maybe I'll kick it to Scott, because I probably should have got this a little bit into my opening remarks, but it goes along the lines with looking at what other schools do, and there is no one set number in any category that is going to have Rowan not close. Remember, we're not talking about closing, but we're talking about things like moving classes, more classes online, or in the scenario of sending people home. But there is no one bit of data. And I think you heard Scott Woodside speaking about it. We're looking at all of the data, hospitalizations, access to supplies, access to our quarantine dorm. And that's part of what the planning did. And I have to say this is one point where we're really grateful for all the hard work the state of New Jersey put into this, because the state from start one has had many thoughtful discussions with the universities about what do we need to do and how do we get about there to stay safe. And just looking at how the state has evolved through its different stages, there's been no magic numbers that has had the state progress through its various stages, what opens when and how certain things open. It's been guided by the total public health picture. And really that's what we were asked to provide in our plan, working with the state to reopen our campus. And that's what we're going to do here going forward. So we're looking at every bit of data, how things are moving overall in the county, how the hospitals are faring, how testing is going, what is our ability to isolate students, what is our ability to track and trace. And so we'll continue looking at that picture. And that's what this group, at least from the Rowan side, is doing, officially 3 times a week, but unofficially 7 to 8 times a week, is we're following every bit of data. And so again, there is no one number that you can point to that will have us take steps in the direction, good or bad, or forward to expanding more classes or ramping back. It's our total public health picture. And that's what people have to remember. And the same thing with the other universities. It wasn't that they had 87 cases and this school said we're going online or we're doing this or we're doing that. It's that they lost their ability to follow their plan. And as long as we have the ability to follow our plan and do the things that we've laid out in our opening plan, we'll continue to operate the way we operate.
I would love to add to that, but you did an amazing job. It's about our capacity to handle what we have. And right now, Triad, our isolation capacity is somewhere around 25% at this point. We're nowhere near capacity there. We have a great pipeline of tests, great partners with Inspira and our local health urgent cares that has plenty of testing available. So all those are great news, and we're going to continue to look at it absolutely every day.
Thank you. Thank you both. Next question is there a website showing the number of cases related to Rowan?
Absolutely. Our return to Rowan website, our main coronavirus information page, does list the historical number of cases by week, and actually going back to March. And we've also we're adding some new data as we observe it and capture it. So you'll see isolation data on there now. So the number of students that we have isolated or quarantined on or off campus is listed there. So if you go to rowan.edu, you'll find Return to Rowan and COVID information right there.
Thanks, Scott. The next question is from an article, excuse me, on Joe Cardonia reported that there were 131 cases active. Obviously, this is from a couple days ago, but only 39 students in isolation. What about the other 92?
Yeah, that's a great question. So the way the numbers are right now, we have roughly 1/3 of our students that we have listed for being in isolation on campus in Triad. Another 1/3 are convalescing or healing or getting better at home. And then the other third have chosen to be in their off-campus house, wherever that is. And it's not necessarily in Glassboro, but it's off campus. So that's roughly how the numbers play out in our investigations.
Thank you. The next question is really, I think I could probably answer this one, give you guys a little bit of a break. Are large student parties in residential areas of Glassboro going to be banned for the duration of the pandemic? And Jack alluded to this a little bit earlier. All we can do, and I know the chief is on the line as well, all we can do is enforce the executive orders. But I do want everyone in Glassboro to know something that Kevin said earlier. Rowan has been so reactive when we've called them, and they've actually been proactive, where Kevin has actually gone out to a party that did not necessarily have more than 500 people that are allowed to gather. The social distancing may not have been there, but Kevin actually broke the party up by himself, at which point the chief had to talk to Kevin and say, that's probably not the smartest thing to do, Kevin. Could you just give us a call the next time you're going out there? So we'd love to say there's no parties. We just don't have the authority to do that. But again, the point I wanted to make here is us, along with Rowan, we are trying to do everything possible when the social distancing isn't kept, when masks are not being worn. We will go out there. And again, one last time, you can call Kevin at 2 o'clock in the morning, as I know some neighbors have, and Kevin will go to a party. And that, I have to tell you, after being involved in Glassboro, whether it's been as the administrator or as a councilman for the last 21 years, I got to tell you, I've never seen that before with the university. So I don't know if anybody from Rowan wants to jump on that question.
I'm going to add, just add to what you're saying about report. When you see things that looks like something's not being done right with students, report it to us, because I'm copied on some of the notices Kevin sends out to students, and I know we act swiftly with students that are caught violating the policies. So I urge the community members, I urge our employees, our faculty, staff, students to report. We act.
That I'd love to add, and the first is that this year, as all of us who are on the panel know, that we are actively out there looking for gatherings and breaking them up, as opposed to waiting until there's a complaint. That doesn't mean that people shouldn't notify us when there's a problem, but know that we are very actively engaged in patrolling the community and looking for problems. The other pieces that might be helpful for people to know is that there is a group of us that meets every Tuesday morning at 10 a.m. to review what happened over the weekend and just immediately jump on any hotspots. So, Chief Palillo, Jack, Ed, the mayor, Kevin's, Mike Kantner, and myself and Monica, we talk every week and we just catch up on what happened over the weekend, just trying to be as proactive as possible of any problems that come up, and to brainstorm for ideas on what we can continue to do, what more we can do, what we can do better.
Yeah, and just to add one last thing with that, Joanne, not only do we talk on Tuesdays, we're talking on Friday mornings, Saturday mornings, and Sunday mornings as well now. I like you guys, but anyway, but thank you all for that. Let's move on to the next one. How many students are being randomly tested each day? Is it only on-campus students? If so, when do the off-campus and commuter students get tested?
Great question. So off-campus and commuter students can get tested at our Holly Bush operation. We have testing available for symptomatic or contacts. That's up and running now. We do that clinic twice a day. The asymptomatic surveillance program started as on campus only, but as of next week, we're doubling that and doubling the capacity and offering to commuters as well. So we're going to be expanding that as we can. and we know that that's going to be key to keeping the spread of the disease low. Once we get through this period, so we're going to continue to expand that as we can. It's a great question, and we're going to keep on that.
Thank you. I think the panel has addressed this, but this has come up a number of times. So I just want to make sure we have complete clarity with this. If an off-campus or on-campus student violates the protocols, are they expelled? And I know Kevin talked about that a little bit. Maybe you can elaborate a little bit more on that.
Yeah, I can promise you that we will address every concern that comes to our attention. As I noted, we're always going to give our students due process. So just because a report's made doesn't mean that somebody's automatically going to be expelled. Some situations it might be an educational sanction. Some situations it might be a suspension or an expulsion. As I said, we have suspended student organizations. We have held students accountable. We will continue to do that. So we're going to take the facts of each situation. I promise you, as I said, every report that comes to me, I read them, I pay attention to them, and I either handle them myself or refer them to somebody who can handle them appropriately. And sometimes that will result in separation from the university. Sometimes that will result in other sanctions.
Thank you. Next question. It seems that many of the positive cases are coming from off-campus house parties and Greek life. What is the university doing about those situations? And are there serious fines and/or consequences? You just basically talked about that, Kevin, for those who host and attend large gatherings and parties both on and off campus.
Well, I'll address the first part of that in terms of where the cases are coming from. So roughly 60% at this point of cases that are active that we're tracking are from off campus. So it's not the overwhelming majority. It is the majority, but not the overwhelming majority. And as you can imagine, so Greek life does play a role only in the fact that there are larger houses typically associated with it. We also have some athletics that have larger houses as well. And we know we have a few cases in some teams, even though we are not practicing, but they're gathering, they're living together. So when you have larger houses, there's a larger risk. So we know that that's the case, and they happen to be off campus as well because they're in a larger house. So it's really a mix. And when you look at on campus, it is not as though we have outbreaks of cases associated at one residence hall. We have what I'm calling social spread, and I reviewed this with state health as well, and they agree with me. This is social spread that we're seeing from students cohabitating. So we're not saying that students aren't partying. We're not saying that students aren't getting together in smaller groups. We are raking up, as Kevin did an eloquent job describing, but what we're seeing is a social spread of the disease at this point.
Yeah, and I also want to share, as Scott has said, not a whole lot of this, if any, is being tied to large parties. But I also want to celebrate there are a number of our Greek students that are doing all the right things. They're being positive members of the community. They're speaking up. They're addressing. They're reporting concerns just like citizens are. And certainly those who aren't meeting our expectations, we're holding accountable.
Thank you. Jack Manning, this next question is, I think, really for you, although I'm sure Rowan could answer it as well, but we'll take this one. Accurate pandemic information is essential. How many COVID cases and how many deaths from COVID in Glassboro and also in Gloucester County? Thank you for all you're doing.
All right, so I anticipated this, so I pulled the stats up on my screen here. So I won't be looking at the camera, I'll be looking at the other screen. So far, since the beginning, our first case was St. Patrick's Day, March 17th, and we had 425 total cases in Glassboro over that period of time. And since then, we've had 7 total COVID-related deaths that were reported to us. The last one was mid-July. I can't give you the exact date. I don't have that in front of me, but it was in mid-July was our last one. We also look at what we call the 14-day window. And that 14-day window is how we kind of get an idea of, it's not perfect science, but it's kind of how we get an idea of how many people are, and since the camera, I see myself here, the camera's on, quote unquote, contagious. And that 14-day window, we're looking at 177 according to our stats. So that's for Glassboro. For the county, the total positives were 4,235 as we speak. And total number of deaths in Gloucester County, 217 since the beginning, since March 17th, since we were the first case in the county in Glassboro. We had the first one. And the last death we had in Gloucester County was probably a week ago. And before that was around the mid-August period was the last death Gloucester County had. We had a lot of them in the beginning. A lot of them were from long-term care centers. We were tracking the long-term care center deaths in the county as well. That's where many of them came from. And just for a point of reference, the average age of positive test results in Gloucester County right now is around 45.1 years of age, and the average age of death in Gloucester County now is 78.3. So that's just some of the statistics we've been looking at. And again, the data comes from, just so we can make sure you know where this data is coming from. It's coming from the County Department of Health. They make this report every day. And then the Office of Emergency Management for the county emails us a report every single day as to the numbers they have in the county, deaths and positive cases. And they'll tell us if a case comes off the list. Sometimes they determine that a death is not COVID related, they take it off, or that a positive test result actually is from another town where you have, overlapping mailing addresses, that type of thing. They'll make those modifications on a daily basis as well. That's where we stand as far as stats go.
Thank you, Jack. A lot of numbers. Next question. With large outbreaks occurring at nearby schools such as Temple, why did you feel like bringing kids back to campus was the right decision?
I'll take that one again. We're comfortable in our plan. Again, we rely on the data we have available to us, and we work very closely with the state and public health officials to develop this plan. What other schools deal with, and in particularly how things are reported, what other schools actually do from an action standpoint, sometimes isn't the complete picture. So I'm not going to comment in particular on what other schools have done or what the responses are, but I am very comfortable with our plan for returning students, and I'm very comfortable with the data we use to support it. So that's how we got there. Probably, sitting here from a personal standpoint, I've said this before at other meetings. Again, it's I personally stand behind the decision we made to put students here, put students in the dorm, and protect the students. I have a daughter who's a sophomore living in a place on one of our housing locations on Rowan Boulevard. So if I weren't comfortable in that plan, I would in no way put somebody in my family at risk of COVID. So if that's not an endorsement of the safety and how much I believe in our plan, I don't know what else is. So, but again, our plan is driven by public health and the needs to provide experiences for these students. And I'm very comfortable with what we've done and how we plan to go.
Thank you.
Maybe we just want to add, Ed, is, Dr. Lohman had said earlier about the fact that we are very closely watching the metrics, as you've heard from all of us, including yourself, Ed. And one thing that we're doing differently, as opposed to bringing everybody back and then having to slow down, is we're watching the data, and we're going to slowly implement more face-to-face activities when and if we are ever able to. So we're watching the data and we're responding appropriately. We're making sure that that everyone is safe, and that what we do put in place is with all the precautions necessary to keep people safe. So we're watching every week. Tony, as the Chief Academic Officer, is looking at the data and making decisions about classes. We have a small percentage of courses, as he said, that have a face-to-face component. That's because they have labs and clinical experiences, and it's required for them in order to be able to graduate. So you don't want a nurse who has never drawn blood to be a nurse. So there are some courses that have to have that, and that are possible, and that must go on in order for them to receive their full education. Adding in those other courses, as Dr. Lohman has discussed, is something that we hope to do, but we don't know if we'll be able to. We're going to keep watching. So the majority of the courses are online. Regarding the students being in the dorms, this is, we believe, the safest place for them. So while we think that, we were not permitted to mandate that our freshmen and sophomores this year live in the dorms, we do believe that that's the safest place for them, because we can ensure that they're getting the medical care that they need, that they get the food that they need, that they're getting the education that they need regarding COVID, how to wear a mask, how to take off a mask, how to wash a mask, everything that you can imagine. Plus, we didn't want to bring students back to campus and not have activities for them. So we have had some activities, lots of them, in fact. They look very different than years past, but we have had college level picnics, we've had food truck festivals, a carnival. They look quite different. They're small and they're very controlled, but that's how we can do it. And so I just want to add that higher ed has, its own standards according to the Office of the Secretary of Higher Education, which is, the governor's arm for higher ed. And the stance that we have always taken in developing and implementing our plans is that just because we can do something doesn't necessarily mean that we should. And that's what we keep asking ourselves. So we're constantly balancing what is good for the students, what is good for the community. Hopefully that helps.
Does. Thank you. This next one is somewhat controversial, but I think we've all said we're going to be totally transparent. And so I'm going to ask this question, and whether it's valid or not, I'm going to throw it out there to you guys. And it says, why did or does the Rowan Wellness Center send asymptomatic students away without help or testing who are seeking direction after they reported that they were exposed to a confirmed COVID positive case?
I'll take this question, not a problem. So the guidance that we have is for anybody that's been exposed to isolate or quarantine. So the immediate intervention is to separate them from society. That is the immediate intervention. Testing immediately once you become known that you're a contact is really not an indicator of your status in terms of COVID. The incubation period of COVID is 2 to 14 days. So a test that happens the day after you had a known exposure is meaningless. And what's happening is people feel like that is now a shield that protects them. And that's not the case. However, we do understand that there are individuals, there are students, there are parents that feel like they need to be tested immediately. So we recognize that, and that's why we've expanded our testing this week to allow contacts to be tested as well, regardless of your symptoms. Last week, we were testing individuals that were symptomatic or high risk and exposed. So remember that the key in public health at this point is to isolate or quarantine. That's the definite intervention. A test will not protect us. A test will only give us a clue in terms of the management of their health. But we have expanded that testing to allow for that. So that's very important that everyone knows that. We certainly aren't turning anybody away. There's certainly plenty of students who are accessing our partners off campus, and that's totally fine. We want them to get a test however they choose to.
Thank you. Next question. We'll try to get in as many more as we can as we start to run out of time. How much input did you seek, you being Rowan, from Glassboro residents before deciding it was okay to allow kids to reside on campus? From a Glassboro perspective, I will tell everyone on the line that you were in constant communication with us. As you mentioned earlier, you extended the check-in times. You've spread out those times. So again, the point that I have made on this call is the communication between the two entities has been better than I've ever seen it in 21 years. But I will turn that over to you guys and give you guys a chance to answer that question as well.
Sorry, one more time. Ed, can you just repeat that question real
How
quick?
much input did you seek from Glassboro residents before deciding it was okay to allow kids to reside on campus?
Well, certainly we were talking with Glassboro about what our plans were. One thing that we know from the Glassboro side is important too, is the economic piece. When the students aren't here, we know that that's difficult for the stores. So certainly I don't want to suggest that decisions were made for economic reasons, but it is to the benefit of all of us if there is economic activity, if there's visitors in the stores. So yes, we were talking with borough officials. We were talking with students. We were talking with our faculty. We were talking with, again, of course, all the local health and public officials. And most importantly, well, very importantly, we were talking with the governor's office and also with the Office of the Secretary of Higher Education to make sure that everything that we were doing was not just in accordance with what they are permitting, but again, what is best for our community.
Thank you, Joanne. And again, I agree with everything you said, and we have been in constant communication. I think we may have time for one or two more, and I have to tell you, I'm shocked that we got through these as quickly as we did, and I think it's a testament to how well prepared you guys are, because I really anticipate us having to take a lot of these away. And here's another good one, and again, it'll show our transparency. What was the count of Glassboro resident COVID-19 positive test cases before the Rowan students returned to campus in August compared to the current count of Rowan on and off campus students and staff COVID-19 positive test cases? Basically, what was it looking like before Rowan students came on, and what is it looking like now? I think we've talked a lot about what it's looking like now. And Jack, I'll turn to you again, and you can tell what it was looking like before.
If you go on to the next question, I will get that number, and by the time you're done the answer to the next question, I'll have the number for you.
Oh, I put you on the spot, huh? Okay. You know, again, I'm not sure where this question's coming from, but I'll put it out there to you guys, okay? Why has the university not reported the number of COVID-19 tests to date, like every other university in the area?
So that is an incredibly difficult number to put out there, because not only are we testing, all of our local healthcare partners are testing. That's not something that every university does. In fact, many universities have zero statistics reported. So I think we're doing our very best to be transparent and expanding that data as soon as we can. There's some information that we are still starting to collect. Remember, students just moved in not that long ago, so we're still in the middle of collecting data. But anytime we have it and ready to go, we publish it. One question I do get, because I know Jack might still be looking for some information, is you know, I get a question a lot about acuity. You know, are people really sick? Are you sending people to the hospital? And the answer to that is no. I've personally done a decent amount of our investigations of our students. The majority of our students, well, maybe about half of our students, have been asymptomatic at all. The students that do report symptoms, they're very mild. They report a headache. Some report loss of taste and smell. Body aches have been relatively common, but most duration of illness is 3 days. I haven't had maybe one student that maybe had an illness that persisted longer than that. And there are no hospitalizations associated with COVID at this point, and hopefully it stays that way. I can tell you we've had a conversation personally with Dr. Condalucci, the infectious disease doctor who oversees Jefferson. He's very confident in how they're managing patients right now. The remdesivir and the oral steroids have been a fantastic medical regimen. So, you know, I'm very confident where we are with our healthcare capacity around here, and the illness that we're seeing has been pretty mild.
Thank you.
Okay, so I have that number. It took me a minute. So we saw our first significant increase in numbers on September 1st. So I'm going to say up to August 31st of 2020, we had a total of 216 cases. And at that time, we ranked number 10 in per capita positive cases in the county. That's why I said we kind of floated between 10 and 12 in per capita. So as of today, we're at 425. We ranked number 4 in per capita, and that was a 209 positive test result increase since the first of the month. That's where those numbers are. And again, there's probably a margin of error, very small margin of error. Or not even margin of error, more of a margin of data coming in at whatever time it came in. So it could be off by 1 or 2.
Thanks.
That's what we're looking at.
So we're at time. It is 8 o'clock, and you know, I just like to close with some comments and then turn it over to Rowan for some final comments. I've said throughout this, the partnership has been excellent. Rowan has committed to the borough that we will do these WebExes as many that are necessary. We really anticipated doing one the end of this month, but when we saw the numbers jump up, we decided to get on the call and talk to the residents right away. So again, I applaud Rowan for that. We as a borough continue to monitor this on a daily basis. We've done very well as a borough in regards to controlling the number of infected employees. We've done an outstanding job with that, and we hope that continues. So again, it's been a great partnership, and we'll have these WebExes. We're all in this together. And Joanne, I'll turn it over to you for any final comments.
Thanks, Ed. We just want to, on behalf of the president and everybody that you see here on the panel and everybody from Rowan, we want to thank you guys for the extraordinary partnership. We agree that it's going extremely well under the circumstances. I mean, this is an amazing time in human history, and we think that we are doing everything possible. It is a Herculean effort on behalf of all the people that you see here and many that you don't, to try to keep people safe. And so we want to thank all of you and all of those who are not seen here for all the work that you're doing. The president has directed us to work with you side by side to make sure that we are keeping people safe. And we intend to continue to do that. And we just value this partnership so much. And a great example is Ed, when you contacted me on Saturday and said, can we do this week? And here we are. And we are absolutely committed to doing this as much as possible. As long as people want to hear from us. I saw that my friend Mark Russell did not submit any questions today, but Mark, I saw that you're here. So we're glad that you're on the call. And we appreciate the comments and the questions and the suggestions, which was said earlier. We do want to take into consideration all of the opinions and the comments and the questions that everybody has. So please keep them coming and know that we're working on this and brainstorming, not just among ourselves, but also with all of you. So thank you.
Thank you all. Have a great evening.
Thanks, you too.
Take care, everybody.